Avera Health is a sponsored health ministry started by the Benedictine sisters and the Presentation sisters really in the late 1800s, predominantly focusing in eastern South Dakota and some of the surrounding states. eCARE, we have found over the years, has really given us a tremendous tool to take some of the specialized physician practices that we work with and really extend them out to a very remote area. We've been able to go beyond the traditional telehealth.
What we've done in eCARE services, we actually have all of the specialists under one roof. So we have a virtual hospital. We have e-emergency, e-pharmacy, e-ICU, all together under one roof, really taking care of our rural population.
In terms of benefiting me as a physician, the biggest thing for eCARE is having the support of a greater network of physicians. You know, when you're in rural America, sometimes you feel a bit isolated, a bit alone. And so having a greater network of support behind you is invaluable.
The virtual hospital concept is very simple. We are taking disparate programs such as ICU, emergency, pharmacy, correctionals, or urgent care, and putting them into one building. That synergy allows us to take care of many different patients at the same time and have some cost efficiency while doing that. Our coverage area allows us to cover thousands of lives, in fact millions of lives, in a square miles that is about the equivalent of France and Germany combined.
E-emergency is a telemedicine device where at the touch of a button, the facility that uses us can have a board-certified emergency physician actually at the bedside as part of their team within virtually seconds. We also have a critical care nurse with us that can assist with any emergency situation. I chose to be an e-emergency physician because I grew up in a rural area and worked as a basic EMT for 9 years. And when I went to residency, I saw a whole new way of emergency medicine. And so when I had the opportunity to come and do this, this was a situation where I could bring that kind of emergency care back to rural America. One of my favorite stories from e-emergency was there was an explosion with 5 casualties, so 5 patients who came, and there was a moonlighting provider there. She had 2 nurses and 5 injured patients, 2 critically burned. So she was able to stay at the bedside while we deployed aircraft, helped her to figure out how to gain access for these patients, helped them to get airway.
In an emergent situation where you need a lot of help in a hurry, and you utilize the emergency to call somebody there, and to have a board-certified emergency room doc over your shoulder is extremely reassuring and extremely powerful.
E-pharmacy is rather interesting. The actual order comes into our hub and we have a hospital-trained pharmacist actually looking at each and every one of the patients who they receive an order from. The technology behind that is they have what is called an automated dispensing machine. The pharmacist actually programs that machine to have that medication available to the nurse when she comes and puts in the patient's name, puts her fingerprint on the machine. It calls up the patient's name then, or she types it in. All of the medications that are ordered for that patient are listed for her. She selects the right one, that drawer pops open, and that's the only medication that's available for her to pull for that patient. Greatly increases the safety of the medication dispensing for that patient.
E-ICU in its easiest description is somewhat like air traffic control. In the background, the e-ICU is able to continuously monitor patients. That monitoring of those patients is done with some decision support software and some support staff such as nursing and physician support. And that allows us to do population management of looking through hundreds of patients, literally looking for those that are having negative trends or perhaps might have a small change in their health status that may not have been able to be recognized by the bedside team. The Avera eAccess program is our umbrella program for our on-demand urgent care platforms. We do this on-demand, not direct to consumer, but to other entities such as long-term care facilities or correctional facilities. What that allows us to do is really provide that care in the location in which that patient resides and help avoid transfers.
Across time, bringing providers into people's lives across technology will only grow.
I think what you'll see, our first step going forward is adding new services, e-sepsis, e-stroke.
Our future is perhaps looking at a model like this e-helm that we're sitting in now and reproducing that across the country and across the globe.
From the patient's perspective, I think it provides that reassurance that the same brand promise, the same quality that we guarantee in maybe some of our larger centers is also available to you in the smaller rural centers. I think about what the future of eCARE can be. Because we've just begun to scratch the surface in my mind.
We're continually looking at what we can do and get out there that actually increases the quality of care that people in rural areas have.